All right. So in trying to know if somebody is pregnant, there's this one test. Not a test. It's a sign. It's something you can observe. So if you observe it, it now helps you to give you a clue. It's not the final say. It will help to give you a clue if somebody is pregnant. Okay. Then you can further do other tests to confirm. It can give you a clue. You do other things to confirm. This is what's known as a Goodell sign. All right. Goodell sign. Goodell sign is just something you observe on the cervix. Alright, something you observe on the cervix. So it's a sign of pregnancy, early pregnancy. So somebody's pregnant, the tummy hasn't started getting big, but you want to know. Alright. So in the Goodell sign, you basically put your hands, you try to feel the cervix. Alright. So which characteristics of the cervix will make you now suspect that somebody is pregnant? So if you feel the cervix, if the cervix is softened, now if the cervix is softened, this will tell you that what blood supply to the cervix was increased. Alright, and blood supply will always increase when there's hormone changes, mostly when estrogen is shooting up. Estrogen and progesterone. Right. So what causes it? So increased blood flow to the cervix during early pregnancy. Hormonal changes stimulate what? The blood vessels to have a lot of blood in it. That's engorgement. Alright. So much blood supply now leads to what? The tissues becoming so soft. Alright. So typically appears between 4 to 8 weeks of gestations. How it is dictated is just pelvic examination. Alright. So you put your hand, you feel the cervix. This one is a Goodell sign. Put your hand to feel the cervix. So the cervix, normally firm like the tip of the nose, becomes very soft like your lips. Right. So it's often done alongside with what Chadwick sign, which this one they're trying to see if there's bluish discoloration, or the Hagar sign, which is like softening of the uterine isthmus. So it's not a definitive thing that will make you know if somebody is pregnant. Of course, anything that could make estrogen levels rise up in the body, it will cause blood supply to be so much to the cervix. But this will only give you a clue if somebody is pregnant. So you need to also do other tests, like ultrasound, blood test, urine test, just to confirm that the person is pregnant. So clinical importance, it actually helps clinicians to be able to know if somebody is pregnant. Right? So it will now help you start budgeting well for the care of the woman as she's pregnant. So that's just it for the Goodell sign.